Okay. Good evening, everyone. I think it is 8:30. Let me see how many participants we have. We have people joining, so that's great. Welcome, welcome. We'll just wait for more people to log in. So I think we've got around 20 odd tonight. So we'll just wait for a few more people and then we can get started. So okay. Wonderful. Okay, guys. So thank you for joining us. We're expecting around 20 odd, so we've got about 8 or 9 people. So we're just waiting for a few more, and then we'll be able to get started. So I hope everyone's doing well tonight. If you're in Sydney or any other state that is unlucky enough to be in lockdown, I hope it'll come to an end soon. But I suppose it gives us something to do tonight. But for the rest of you who are lucky enough to not be in lockdown, we're a bit jealous. Now, just everyone, if you can obviously make sure your microphone is on mute, and also obviously your camera as well, I guess, unless you want to show us your lovely face. But otherwise, we will just give it a couple more minutes and then we'll get started. So I think most of you can probably see, hopefully myself, Ernie from Samson Medical, and also Deborah Stracey from Australian Tissue Donation Network. You can probably see the two of us. Ooh, wrong slide. Go back. Here we go. Okay, so looks like we've got about half the people. So Deb, would you do you think we should get started?
That sounds fine to me.
Just wait a couple more minutes. Obviously, I know tonight is 8:30 start, so I don't want to keep everyone longer than we have to. So let me see how we're going.
And probably tell people about the questions while we wait.
Yeah, okay. So tonight, obviously, guys, when once I do a quick little intro, I'll obviously introduce you guys officially to Deb, who will take us through her presentation on everything tissue donation. So during that time, you guys should see a Q&A button on your screen, either top or bottom on the right-hand side. Or thereabouts. And if you have any questions you'd like to ask, please feel free to type the question into the Q&A. You can do that anytime throughout the talk. And what we will do is at the end, when we finish the presentation, then we will have the Q&A answer time, and I'll read the questions out to Deb, and Deb can then, of course, answer them. So if you'd like to put your questions down on the Q&A, we will answer them at the end of the presentation. Okay. So in saying that, look, I think we have waited almost 5 minutes now, so we've given everyone a chance to get in. So let's get we've got one more join. Perfect. So let's get this started. So once again, good evening, everyone. Hello. Hope you're all well. My name's Ernie Chan from Samson Medical Technologies, and I'll be your host tonight for tonight's GameChanger educational session. So I'd like to extend a big warm welcome to all of you, and thank you for taking the time out of your busy schedules to join us this evening for what we hope will be a very interesting and informative session all about tissue and bone donation in Australia. So most people in Australia, and certainly those of us in the medical profession, are well aware of the importance of organ donations and the life-saving gift that it is, and rightly so, because to an organ transplant recipient, it is truly life-saving and of course life-changing. However, just as life-changing and perhaps maybe even life-saving, but thus far have been somewhat outside of the limelight, is tissue and bone donation. So you don't hear a lot about tissue and bone donation, certainly not as much as organ. And of course, unless you're an orthopedic surgeon, of course, in which case you would have been using human donated bone grafts for decades and know that it's the gold standard for best patient outcomes. During the past couple of years here at Samson Medical, we've been supplying and supporting a range of allograft products, such as costal rib cartilage segments, cortical and cancellous bone-derived material in various form factors for use in a wide variety of surgical applications, ranging from rhinoplasties, ear construction, through to oral maxillofacial and dental applications. So unlike orthopedics, the use of, I guess, off-the-shelf human donated allograft products, especially in sort of plastic surgery, OMF surgery, and dental applications, is still a relatively new practice in Australia, although it is widely used overseas and has been for many years. In saying that, in Australia, it is certainly growing quickly and it's fast gaining acceptance and support by many doctors and surgeons as they realise the benefits of using high quality Australian produced allografts. So tonight, we've invited one of Australia's most knowledgeable, experienced, and certainly most passionate tissue and bone donation champion to be our guest speaker from the Australian Tissue Donation Network. So everyone, I'd like to introduce you all to Deborah Stracey, who's the Executive Director of the ATDN. So Debbie completed her Diploma of Nursing in 1991, then worked in many fields of transplant in St. Vincent's Hospital, including cardiothoracic and renal, followed by 12 years in bone marrow transplant and hematology across various roles, including nurse educator, clinical nurse specialist, and clinical nurse consultant. Debbie was then ICU certified in 2002 and spent many years working in this specialty before eventually becoming the clinical nurse consultant in oncology at the Northern Cancer Institute at North Shore Private. In 2015, she started working at Australian Biotechnologies before moving over to Australian Tissue Donation Network a year later in 2016, where she also completed her certification in tissue banking specialization. And in 2018, Debbie completed her Masters in Donor Healthcare pilot program with the University of Amsterdam, and recently in 2020 also obtained her Masters of Business Administration. Now, I think it's safe to say that Debbie knows a thing or two about tissue and bone donation. So with that, I'd like to hand over to Debbie. Thank you, Debbie. Once again, we appreciate your time and your participation tonight. Over to you.
Thank you very much, Ernie. I appreciate that. I'll just share my slides. So thank you to Samson for inviting me here tonight, and thank you to everyone for joining us. It is lovely to talk about donation. It's my favourite topic and I could talk about it all day. So the, now I'll just get a handle on that. So what I'm going to talk to you today is about Australian Tissue Donation Network, our donation programs, the type of donor screening and standards that we have, the type of tissues that we retrieve, and a little bit about deceased donation, because it's one of those things that people don't really know much about, and it's one of those sort of a bit behind the veil type things. And also talk to you about community and hospital education that we provide. So a little bit about us. Australian Tissue Donation Network is a not-for-profit procurement agency. We work in partnership with the New South Wales Bone Bank and Donate Life, and we work very closely with both of them. Our aim is to increase and facilitate donations of all types of tissue through Australia, and as Ernie alluded to, organ donation is very well known, and tissue. So all we hear often is organ and tissue. So we're trying to bring tissue a little bit more to the forefront. So increasing the awareness of tissue donation, providing education to both health professionals and to the Australian public will assist in that. I, for one, didn't really know much about tissue donation at all until I worked in the field. So Australian-made, Australian-sourced allograft availability is vital for Australians. We have some of the most stringent regulations governing the retrieval and the manufacture of donated tissue worldwide. And this means that we can actually provide some of the safest allograft, which is very good for all the recipients. The regulations in Australia, I'm sure you all know about the TGA, and they set the regulations and legislations and the rules that we must comply with. So we take pride in the fact that we have these very stringent guidelines, although the foundation of our guidelines is very similar to that of Europe and the US. So, and that includes the times, temperatures, and things like that we have to abide by. However, even the FDA and the EATB can't hold a candle to the TGA, and certainly we are very conscious of safety, and it provides a high level of protection for both the donor and for the recipient, which is what we really want. So we start off with donor screening. So you get a referral for a donor, and first of all, you have to make sure that they're eligible. So the first thing we do is ask some questions, either to themselves if they're a living donor or to their next of kin. And they must meet the criteria that is set out in one of the therapeutic goods orders, which is TGO 88. This is also, this is the standard for donor selection, testing and minimising infectious diseases. It is via the Therapeutic Goods Association that all human blood and blood components, human tissue and human cellular therapies are all under the same therapeutic goods order. And this means that we have to very closely adhere to this, or very stringently adhere to it, and make sure that our donors don't have any risk factors such as travel, previous cancers, autoimmune diseases, things like that. There are a whole list of things that can rule somebody out from actually being a donor. The therapeutic goods orders also cover the transport of donated tissue, and also the time frames in which things must be done by, and the level of the oversight from retrieval to implantation is very, very thorough. So TGO 87, for instance, covers the requirements for labelling of the biologicals, and TGO 83 covers the biologicals that are human tissue, and this includes muscle, ligaments, bones, cartilage. And this is from either living donors or from deceased donors, so it covers both. Donation in Australia, unfortunately, isn't as high as we would like, especially the last few years. COVID has really affected donation numbers, simply because families are not allowed in the hospital as well, as so consent rates aren't as high, and Donate Life is also having lower consent rates. But it's something that we are really trying to get a lot of awareness about, so that we can help with this situation. So there are approximately 15,000 orthopaedic and spinal patients annually, Australia-wide, who have required bone supplementation during their surgery and have really benefited from the donation programs run by run by ATDN, monitored by the TGA. And it's very interesting, because I didn't know this at the beginning, but bone is actually the second most transplanted tissue after blood, which is quite amazing. So we have at ATDN living donor programs, and we have the femoral head donation program and the placental donation program. And this enables Australians to consider donation while undergoing routine surgery, which is a great way to introduce the community to the concept of tissue donation without them having to have lost anyone. The femoral head donation allows patients who undergo regular hip replacement surgery the opportunity to donate the tissue that's removed as part of this procedure. So the femoral head, which is a good mix of cortical and cancellous bone, is able to be used and to make products such as crunch. It's used in spinal, orthopedic and dental surgeries, to name just a few. And one person's donation of a femoral head can actually provide enough allograft material for up to 4 recipients, which is great. So here we have some fantastic photos showing you how applying crunch in oral surgery. Now, one of the great things about using pre-made or off-the-shelf human tissue products is that when you retrieve human tissue during a surgery, you've got longer surgery times, 2 wounds, and when you're void filling with that tissue, you've got lipids and blood and things like that that will actually disintegrate over time and leave small little holes. Using the crunch that is pre-prepared and through its processing has no lipids or blood or anything else left on it, it's just purely bone, you're able to pack that void very well without leaving any gaps. Oh, sorry. So we also have a placental tissue donation program. This is fairly new. In countries like Malaysia and overseas, they have actually been using placental donations, chorion and the amnion, for many, many years, over 30 in Malaysia, and they use it for so many things. It really is the go-to for implantation and wound barriers as well. It gives patients who are having an elective caesarean surgery the opportunity to donate their placental tissue that would otherwise be discarded. So what we really are after is the amnion, which is the innermost lining. And the program is able then to provide some tissue for many other types of allografts. So one of the things that it's very, very useful for is things like venous leg ulcers, diabetic ulcers, non-healing ulcers are able to have been really assisted very quickly. So a ulcer that has been treated for months will be able to be healed within 2 to 3 months with the use of amnion grafts. Placental tissue can also be used during surgery, wrapped around an anastomosis in bowel surgery, for instance, will prevent adhesions. And they also are using it in tendon surgery as well to wrap around the tendons to stop them developing any adhesions. So it's the grafts have been used in many subspecialities such as dental, sports medicine and cardiac care. They actually overseas are using amnion grafts to once you've packed a void with bone, they're actually using the amnion then to cover that as well. So jack of all trades it is. We provide a lot of support for the hospitals that participate in our program. So we provide all the grafts and all the kits that they need for retrieval. We also provide a lot of education, and we like to provide the education to all around the hospital. So the wards, the surgical staff, the doctors, even the theatre managers and ward clerks, because the more people that know about it, the more people that are able to tell their friends about it, the more people that will know about it. And I also find in my own life, and I found with others, the more people understand something, the better they are at doing it, and the better they, the more desire they have to actually participate in it. So I always feel education is a great thing. How we identify the donors. So our living donors are identified either by filling out a form at their surgeon's rooms or by the pre-admission clinics. Now, currently, we're having a lot of our pre-admission clinics by telehealth, which hasn't stopped us. It just has made us navigate new ways and been able to, the hospital will discuss with the patient whether they want to participate in the program, and if they do, we are given their details and we follow through, and we do all of the screening. And for deceased donors, the consent is provided by the senior next of kin, and so it's really helpful if anybody does want to be a donor, they really do discuss their wishes with their family, because ultimately, whether you filled in a form for Donate Life or through Medicare or anything else, it will actually come down to whether your family agree at the time. So it's very important for people to discuss their wishes with their families. As Ernie has said, everybody thinks of organ donation. Now, to be an organ donor, you have to die in quite a specific way, and it's actually only 1 to 2% of the population that will ever have the opportunity to become organ donors. With tissue donation, we have a much longer time frame, so it actually really increases the chances of becoming a donor to about 38% of the population. So things you can donate are your eyes, your skin, which we saw in the White Island tragedy. Skin was really helpful for those survivors. Ligaments and tendons. I mean, there's lots of footballers running around with tendons that have been donated and ligaments. And bone donation has been around since the earliest recorded is the 1600s, with some evidence of it being done earlier than that. But it was very rudimentary, not much screening going on, usually a battlefield where they take a bit of bone from a dead person and put it into a living person. And I don't know how successful they really were with that. So there are many types of bone allograft, and you go from the void fillers to structural allografts. And some of these are, as Ernie said, really life-changing. I was at a conference in the States, and a boy who'd had an osteosarcoma went into theatre not knowing whether he would lose his leg or not, and came out, walked across the stage with a basketball with his own two legs, having been able to remove his femur, replace it with a rod and lots of crunch and a donated femur. So it's a real, it does change lives. It really does enhance those lives. So orthopedic, spinal surgeons and neurosurgeons have been using human tissue allografts for many years, and it is really seen as the gold standard treatment. The screening, we do get asked a lot of questions, you know, how safe is the tissue? I can assure you all donors are screened very meticulously. The legislations in place and the guidelines in place are very, very rigid and very, very safety conscious. So screening of deceased donors requires an interview with the donor's next of kin, as well as their medical history, their travel history, their behavioural risks, everything. We try to know everything about them. We also have access to basically from referral to implantation of that tissue. So I can tell you what size gloves, what batch they came from, and what the expiry dates were of the gloves that the retrievalists were wearing for each donor. We have very good oversight, and over 15,000 of allografts from ATDN source tissue were implanted in the last 12 months in Australia, which is fabulous. And I'm sure there's been actually hundreds of thousands of grafts over the years. So how do you go from the donation to the allograft? So we procure the tissue, and we have a partner that who manufactures the tissue. So they make cortical sheets, costal cartilage. These type of allografts are used mainly for and Ernie's probably the best one to tell you, but mainly for rhinoplasties, septoplasties and things like that. And they've been very successful over the last few years. I've heard a lot of great things about those. Now, I really must acknowledge and thank very much Dr. Andrew Greensmith and the Avenue Private Hospital in Victoria for allowing us to use these photos and really talk about this amazing surgery. Now, when we talk about changing lives, this is one of those operations that really does do that. This young lad didn't have a proper ear, and we were able to fashion one, I say we as the collective royal we, out of the costal cartilage. As you can see here, you can see the design where they were drawing it. Some fantastic surgeons being able to put it all together, and it really astounds me what we were able to do with it, because look at that, and that is really life-changing. So this young lad will grow up with an ear looking like everybody else and probably have 20 piercings in about 20 years. So who knows? So what can you do? Deceased donation, are you registered? Have you talked to your family? If you want to register, you go to Donate Life. You as surgeons, it's great to be able to really acknowledge that allografts do come from donors, and that these are gifts, and these are lasting gifts. These are gifts given sometimes at the worst time of somebody's life, and it really offers family a lot of hope to know that some good can come out of something bad. So talking to the family is very important. As an organisation, ATDN are looking to introduce donation care as a routine part of the end of life care. You can actually donate bone up to the age of 90, from 16 to 90. So we've got a big, long age gap there. And although donation is a relatively new area in healthcare in Australia, it's certainly an up and coming one, with tissue being able to be used in so many amazing surgeries that really do change lives. We are doing it slightly different. Rather than being a tissue bank and trying to accomplish everything, we've really focused on where our strengths lie. And so we look at doing the donation side of tissue banking and doing all the donor screening. Most of the staff at ATDN have medical backgrounds, paramedics or ICU nurses like myself. We also provide a lot of education and training and facilitation for our hospital partners. And we do work very closely with New South Wales Health, and actually are part of their retrieval program. So once the tissue's been retrieved, it's sent to our manufacturing service provider, and it gets quarantined until it's cleared for manufacturing, which is a whole different process with a whole different group of legislations and GMP and everything else to really make sure that the standards are incredibly high. There's never been any recalls with the tissue. Our partnership with Australian Biotechnologies has really provided hundreds of thousands of allografts for Australians in need, and I'm incredibly proud of that. So our mission is to give the gift of healing to those in need. So allowing us to deliver the message of tissue donation options before and after death to school students, hospital staff, allied health staff, members of the community, and we do it throughout New South Wales and also Australia. We have got the highest retrieval programs in Australia, which I'm also incredibly proud of, and I think our tissue is of the highest standard, because I know that we are very, very stringent with our screening processes. So one of the best things about doing what I do is actually we get to talk to every living donor, and we really get some great feedback from them, because for many of them, they're having an operation that they were always going to have, and it just makes the purpose of that operation a little bit brighter, being able to donate. And so we do get some lovely feedback. From families from deceased donors, we also get lovely feedback, because for many, they really see a purpose where there's been a sad death, and that's a really nice part of what we do. So I thank you very much for your time, and I'm very happy to answer any questions if there are any.
Thank you very much for that, Deb.
Okay.
Sorry, can you hear me?
Yep.
Okay, cool. Let me just quickly put a slide back up there. Yeah, that was fantastic. And I think also one of the biggest things that sort of struck me when we were talking about this about a week ago in your office was just how much information you've got. And, compared to even things like, Sago charts and fluid charts and everything that you find in hospitals, they don't contain nowhere near as much. I think it was what, 56 pages of a document that you've got that documents every little detail. And the fact that you can, even know the glove size of the person who took that tissue is just pretty amazing.
We have fabulous oversight, and some of our charts are up to 2,000 pages long. Like we have, what if they've had a recent operation, we'll know everything about that. We'll know everything about the hospital stay. We do, and even for our living donors, if they've ever had any bit of been to sun doctors or something, had a bit of skin, we get all the pathology results of that. We really follow everything up. And so I'm always very conscious that safety is number one. And I really think that I can hand on heart say that there is nothing about these donors that we don't know in the end. We're very lucky to be able to access so much information and have such great oversight. And it means that we actually have oversight over the whole process. So we even know from the number of what gets implanted to where that donor came from, who retrieved, everything. So we're able to see from beginning to end.
And you have to keep those records for quite a period of time, I believe, isn't it?
We do, yes. Yes, so we have records going back many years, but we keep them a minimum of 10 years after the graft is implanted.
Right, 10 years after. Wow. Okay.
Yeah.
So anyone, just seeing if anyone else has any questions for Deb or us. If you do, there should be on the bottom of your screen, although on mine it's at the top, but on the bottom normally there's a Q&A button. If anyone wants to ask any questions, feel free to click on the Q&A button and type a question in, and now's the time for us to answer any questions you have. But yeah, thank you for that, Deb. That was really fantastic seeing just sort of, how, and I guess sometimes that's the thing, most people don't really get to see, sort of behind the scenes and the transparency, of how the whole process works, which, obviously makes it so much more assuring now that we know, the not only from a government TGA regulations perspective, but also just the lengths that you guys go to, for example, to source the material. And then obviously following that, there is even more, I guess even more processes and safety behind it in the manufacturing side. And I know certainly, when we supply the grafts and I go to support one of the surgical procedures that, we have, everything from, if it's frozen, we have those frozen tags to make sure. We have to check even before we open it, packaging and, temperature. And so it really is amazing how much work goes into that, to the point where, like I was saying before, even it's more than what you would have to go through looking after a sick patient. Okay, so I do have a couple of questions here, Deb.
Okay, great.
Okay, so the first one is, how do we inform our patients on how to become donors? What can they do to become donors?
Okay, so, well, first of all, they can either go to the Donate Life webpage, so donatelife.gov.au, and register there. So in the last few years, they have got and tissue on it. And or they can go to the Australian Donor Registry, which is part of the Medicare website, and you can donate. You can get your donor card from there as well. So the most important thing, though, regardless of doing those two things, is to actually tell your family your wishes. And it would be great. I do often say, anytime I give a talk in any hospital or anywhere, because sometimes I just do them ad hoc over a wine, is that now that I've told all of you about it, you all have to tell 10 more people. And that's how we'll spread the word. And that really is one of the most important things.
Fantastic. And look, yeah, I think I'm certainly, and I've been signed up as a tissue donor for a while now. So just need to tell everybody else. Okay, so the second question we've got, how different is your retrieval process to other bone banks? And can you elaborate a little bit more on the process? Should the tissue be soaked in antibiotic? And then for how long prior to implantation? So maybe that's two questions there, I think.
Yeah.
So let's just go with the first one, which is, how different is your retrieval process to other bone banks? Perhaps can you elaborate a little bit on, because I know you've got very well-trained staff that take care of that. So if you can elaborate a little bit, that'll be fantastic.
So the difference with ATDN, as far as I'm aware, is in which we do all the screening ourselves for all of our donors, for our tissue, especially our living donors. In some other tissue banks, they have trained staff at the hospitals to do it. Because we have a lot of hospitals and we live in Sydney, it's not physically possible to get around to all the hospitals to interview that many patients. So we do it via the phone, and because we have got really well-trained staff, we're able to follow up on questions, and each of our questions has another question that follows on. So, you can say no medications, and then there'll be another question that also relates to that later. So you're getting confirmation of answers. And we were very an integral part of putting the Australian DRE together, which is the donor risk assessment interview that Donate Life does. And ATDN was a part of developing that. And that's actually what we use as part of our screening tools. Right. So we also are very cognizant of safety. And so we actually have some eligibility criteria that is maybe stricter than some of the other tissue banks, but each bank starts with TGO 88 and then they may have some extra criteria added on to that that they've decided, or the medical director has decided is important for the quality of that tissue.
Right. So look, just coming to that second part. Coming to that second part of the question, should the tissue be soaked in antibiotic and for how long prior to implantation? Look, I guess that's probably more maybe your personal opinion based on your nursing career in the past and all your experience in obviously participating in potentially the use of a lot of this. And if, I guess if, yeah.
Well, I'm not generally there when the tissue is implanted. However, the tissue goes through a processing or the process it goes through where it is very, very clean. Like it goes through a lavage process. So I'll just talk about crunch for a second. It goes through a lavage process where it's washed several times. It comes out white. It goes through supercritical treatment, which basically is a liquid and a gas under pressure of CO2 that really cleans it out. There's nothing that could be on it. So it just gets mixed with blood and can be implanted. Mm-hmm. You're more there in the theatres than I am, so you're probably a better place to answer that. But certainly the tissue is sparkling.
Yeah. Okay. So I guess maybe, you know, look, I suppose different surgeons and different doctors might have their own preferences of how they want to do things as well. But certainly, you know, from my perspective, I guess having been in quite a few, you know, cases with different surgeons is that, you know, some of them will prefer blood, some prefer just to rehydrate with, you know, saline, which is what we recommend. But yeah, look, I mean, I guess maybe potentially there's no, you know, no harm in soaking the antibiotic, but I don't think it's required, is it? Like, it's not something that we would require. Yeah. Okay. So thank you guys for your questions. So they were very good questions. So if there's anyone that's got any more questions, please feel free to throw them up. If there isn't any more, what we will do, like I said, it is late in the evening, so we will probably wrap things up in a minute or so. Just give everyone one last chance to potentially throw up some questions for us. But other than that, I think after this, Deb, definitely time for a wine. And so thank you again for tonight. It's been really interesting. And I think a lot of people hopefully would have found, you know, the insight and certainly the transparency into how this whole process works may alleviate some of their concerns regarding, you know, the use of the allograft as well. But guys, if you are on here and you want to participate in our next webinar, which is on October the 7th, I believe. It's with Professor Bill Walsh. He will talk a little bit more. He will talk more about using allografts as well. So please register for that one if you haven't already. And if you have, then we'll see you on October the 7th. So if there's no more questions, and I don't think we've got any more, looks like everybody...
Can I just ask a question as well?
Yeah.
If any of your surgeons that are on here are doing any surgeries with the tissue and they would be happy for me to share their photos, Donate Life are looking for stories on tissue recipients to be able to close that part of the story, because one of the issues with tissue donation is nobody knows what they really do with it, and it hasn't previously been talked about. So that would be great too. Yeah,
fantastic. No problem. And we'll see if we can help with that as well. Okay, so fantastic. All right, everybody, thank you very much, ladies and gentlemen, for sharing your time with us tonight. So we will wrap things up here, and we look forward to seeing you at the next educational session. It's the Samson Medical Technologies Game Changer series. So good night, everybody. Stay safe, and thank you all for being here tonight.
Thank you very much.
Thanks, Deb.
Bye-bye.
Bye.